Hi, welcome to the Post-Acute Withdrawal Syndrome presentation, also known as Paws. It's part of our recovery program. My name's Angel. I'm a registered clinical counselor and a clinician for a day treatment program. This presentation is to kind of walk you through what you can expect as you stop using your substance of choice. Paws can cause a whole range of symptoms that show up as a combination of physical, cognitive, and emotional symptoms, and these can last a few weeks, months, even years. When you first quit using, acute withdrawal will start typically in about 8 to 24 hours and then peaks around 48 to 72 hours. Keep in mind this is going to vary depending on which substance or alcohol that you're using as well. Pause itself starts in that 10 plus day range. The new normal can take years to figure out. These timelines are going to vary also because of your age, the kind of use that you are engaged in, your physical health, and your brain's plasticity, which is a fancy word for how quick your brain can heal. In the previous slides, did you notice that there's an acute, which is almost all physical, and a post-acute, which is all emotional and psychological? The very first things that happen are physical. And this makes sense because our brain is used to getting that substance that we're using, and that impacts the chemicals that our brain is producing and how it interacts with those chemicals. When you stop, your brain's job, when anything changes suddenly in that chemical balance, is to alert you that you're probably in danger. And so it doesn't differentiate between natural things that you might stop, like eating food. For example, if you suddenly stop eating food, your brain's going to give you these same symptoms to go, you're in danger, you need to stop, you need to fix this. Because it's used to using the substance and having that specific activity go on in the brain, it's going to think it's under attack and it's going to give you lots of symptoms. That stage can last up to 2 weeks. It is mostly physical, and there is some support for that. It is strongly recommended, especially for alcohol, benzodiazepines, and barbiturates, that at this stage, because there's such a high risk for fatality and other really scary health effects, it's really recommended that you have medical support in place. There is support. You can reach out to any doctor or opiate agonist treatment program to see what kind of supports you can access. I believe most emergency rooms are also equipped to find you supports around that, as are detox centers. So when you quit without medical support, there can be a wide range of symptoms like sleep issues, vomiting, nausea, increased heartbeat, excessive sweating, tremors, burning and itching, dry mouth, and some pretty intense headaches and pain in the brain, as well as ending up in a coma. With medical support, most people experience a dramatically easier withdrawal, although some symptoms of increased heartbeat, nausea, and headaches and leg pain are common. They're typically less severe. It's after that acute phase that people enter into pause. That phase moves away from all of those physical symptoms that are so heavy into more emotional, psychological, and cognitive symptoms. Those symptoms will be sporadic, not constant, and they typically lessen over time. These symptoms can take 2 years before they subside entirely. For a very short time when you hit this phase, you might experience paranoia and severe anxiety. If that happens, talk to your healthcare provider and don't panic. It will subside. Other symptoms can include brain fog, emotional dysregulation, which is when you find your emotions feel really big and hard to control, feeling very empty inside, worry, anxiety, sleep disturbance, irritability, short-term memory, low energy, and depression. And these are just caused by the brain trying to return to its natural balance and can take years to clear on their own. If these symptoms are getting in the way of your safety or sobriety, talk to your healthcare provider. That said, there are several ways that we can help cope with these symptoms, and as an additional little benefit for that, those coping skills can help you also just live a life with less stress and help you deal with cravings and crave less. Self-care, which is not just having a bath or eating right, is super important to deal with post-acute withdrawal symptoms. And it includes things like developing healthy friendships, discovering activities that bring you peace or joy, ensuring your physical health is looked after, finding ways to participate in your community, building connection with your spirituality. You can also use things like mindfulness strategies to make sure that you're giving your body time to be relaxed and lower your cortisol, which is a stress hormone that happens when we're stressed. Making sure you go to bed on time or getting restful sleep, avoiding caffeine, and really connecting to your purpose in life, which means thinking about your values and trying to make decisions that support those values. That can also look like avoiding places and people that trigger you, getting counseling, working with a doctor to improve your health, all those great things. And that takes us to the end of our workshop on Paws. If you have any further questions, please don't hesitate to reach out to your healthcare provider or to your local recovery team. Thank you. Have a great day.